Hey guys, Dr. Ray Marque here, your local chiropractor at Back Pain Relief Center down here in Murrells Inlet. Coming to you on Friday, I think today's the 27th, and it's around lunchtime, and we're going to talk about a couple of things today. Number one, just a little bit about us. We're located down on Wachesaw Road, so 675 Wachesaw Road in the Mallory Center, and we are here Monday, Tuesdays, Fridays, and Saturdays. So today I'll be here at about 12:30. I'm going to go grab a little lunch and I'll be back at 2:30. And I'll be here all the way to 6. And then again tomorrow morning from 8 to 10. So if you have any neck or back concerns or any joint concerns really, and you're not sure what they are or see if we can help, just message me on Facebook or just walk in and we'll fix you up. So today I'd like to talk about one of the cases that I've seen recently. And this patient came in and she had leg pain. She's saying that her hamstring hurt or all the way down to her knee. So we're looking at leg pain or pain behind her leg all the way to her knee. So a couple things pop up right off the bat. And number one, as a chiropractor, I'm thinking back stuff. So the first thing I'm going to rule out is number one, let's say we have a back issue that is causing pain to shoot down the leg. A lot of you may know that as sciatica, okay, or lumbosacral or lumbar radiculopathy. And it happens quite a bit. But with this patient, we did an orthopedic exam, did a neurological exam, we got the history, and we figured out that most likely it's not coming from her back. So what else could it be? Well, we got a little more information, and there's a certain sport that the patient had been playing and things that maybe may have contributed to it. So we did an exam right on the hamstring. Do we have anything torn? Is there any bruising? Is there any limited range of motion? Are there any trigger points or spasms in the muscles that may be contributing to this pain? And we did that, and you know what? The hamstring seemed like it was okay. I didn't see anything that would warrant that there was a tear or dysfunction of that particular muscle. As we got a little more information out of the patient, and as we got further along with our exam, we started pinpointing towards her knee. And come to find out there's an underlying issue there. There's a torn meniscus. It's been an ongoing thing. We did an exam there. Palpated the area, went over some old imaging, and it looks like it is the meniscus that's causing that pain. A lot of time we can have knee pain that can radiate or make that leg dysfunction a little bit or cause pain in the back of your leg or the back of your knee. And hers was more to the inner side of it, which was all kind of pointing to this. So we figured out it wasn't her back, it wasn't her leg, but most likely her knee. So what were the options? So I give all of my patients every option out there, and whichever way you want to take it, that's great, that's up to you. And I understand all of them, because you know what, there's a lot of things that hurt me and I don't always do the things that the doctors tell me to do, so I always start off conservative. So these were her options. Number one, I said, hey, why don't you go home, you can ice it, you can use a TENS unit that we gave you, you could put a brace on it, and you could give it some rest, if able, and you're allowed to take some over-the-counter anti-inflammatories, maybe that'll help too. And let's give it a couple weeks and let's see if it begins to improve on its own. Because you know what, torn meniscus, there's a lot of people that have one, including me, that you don't necessarily have to get them fixed right away. Some that are making your leg lock up, maybe they need it right away, but it all is kind of a comfort thing and a functional thing. So if it's not stopping her from doing something she likes, or it's not causing her pain that's interrupting her lifestyle, then let's try to do some conservative stuff. So option number one was to use her TENS unit to ice it, put some biofreeze on it, put a wrap on it or knee brace, limit the things that are aggravating it, and let's give it some time to see if it gets better. That was option number one. Option number two, if that doesn't work, we have two ways to go. Number one, she can come back to me. We can do some manual therapy on the muscles above and below the joint. We can also use our cold laser, which has great effects with knees. I have a lot of success with getting inflammation down, reducing pain, and getting you back on their feet with using a cold laser. The one downside of cold laser is it takes 3 or 4 weeks to work. We have to see you 3 or 4 times a week. Now I get that. It's not in everyone's schedule. Some people, number one, don't have the time to come in. Number two, maybe it's a financial option. Or number three, maybe the problem just isn't big enough for them to want to commit to that much time, which is all good. I get it. So that was her second option. So first option, conservative treatment at home. Second option was to come back in, let me do manual therapy on it, do some cold laser, do some more physiotherapy type modalities, and try to get it to calm down that way. That takes a bit more of a commitment. Option number 3, go to the orthopedic. Okay, I have no problem with that. Those guys specialize in these. They'll look at it, do an exam in a minute or two, and know exactly what it is and what they recommend. That is a very viable option when it comes to shoulders, knees, and really backs for that matter. Each individual is different, and you take this care however way you would like to. And if going the orthopedic route makes you feel better, that's the way you want to go, I'm all for it. I refer to orthopedics all the time. I have some very special relationships with orthopedics, and I think they do a great job. You have that route. Okay, so that's a third option. A fourth option, call your primary or go to an urgent care or maybe back to the orthopedic, and maybe they can give you an anti-inflammatory injection. Maybe there's a stronger oral medication they can give. Maybe there's some physical therapy modalities they want to refer you to that I don't have that will work. One way or the other, what I did for my patient today was lay out all the different options and let them make the decision. It's not up to us here at Back Pain Relief Center to make that decision for you. Granted, I'm partial towards spinal manipulations and manual therapy because I'm a chiropractor and that's what I do. Orthopedics are going to go a different route because that's what they do. I don't think one's good or bad. One may be more appropriate for a condition than the other person, but let's figure out what it is. All that being said, if you have a neck or back problem, or really even a knee problem at this point, and you're not sure what to do about it, maybe you're a little hesitant about chiropractic, you're not sure if we can help you, that's okay. Message me on Facebook, we'll talk about it. You can even call me at the office. That's 843-804-8100, and I'll talk to you about it and see if it can help. Or just stop on in, we'll sit down, we'll talk a bit, we'll do an exam, we'll figure out what the problem is and figure out what the best course of care is for you. All right, so that's our little talk today. A little more things about us. You can reach us, everyone in Myrtle Beach, you can reach us at murrellsinletchiropractic.com. Again, that's murrellsinletchiropractic.com. You can always message me on Facebook at our Back Pain Relief Center site on Facebook. And I'm open Monday, Tuesday, Thursday, Saturday. So Monday and Tuesday from 8 o'clock to 12:30. Again, 2:30 to 6. So 8:30 to 12:30. I keep on saying it. 8 to 12:30. 2:30 to 6, Monday and Tuesday. Friday, it's a little off because I'm flying in from New Jersey. The hours are 10 to 12:30, and then again, 2:30 to 6. I know a lot of chiropractors in the areas aren't open Friday afternoons, but we're here for you if you need us. And then again, Saturday morning for a couple hours, 8 to 10. Limited hours then because I also teach judo at Myrtle Beach, BJJ and judo, so I got to get over there. All right, guys, I hope all is well. It was great talking to you. Have a great weekend. Stay warm. If you have any questions, call me. Thanks. Bye-bye.